We're not doing orthodontics any way, shape or form like I started 30 plus years ago. Traditionally, most orthodontists just look at a lateral head film to kind of make a diagnosis. You do frontal head films and you do tracings to look at symmetry and those kinds of things, but really those are only two planes in space. The Kodak 3D cone beam CT machine allows us to see unerupted teeth, impacted teeth, with a lot more predictability. A lot of times before, with a 2D image, we can see the tooth, but when we try to bring it in, it may be interfering with the roots of adjacent teeth. Now when we can rotate the image and see it in 3 dimensions, it makes it much easier for us to avoid root resorption and some of the other issues. Prior to this time, they would estimate what the roots look like, but now with the cone beam 3D scan, we can actually see where the roots are and make sure that we've got the roots parallel, and it just gives us a much better result. We're now being able to see things that we never could see before. The response from referring dentists has been very positive. They're looking at patients that they want to place implants in if they're missing teeth. And because of this technology, it makes it very easy to see how much bone there is and whether an implant's going to fit and whether they need to do a bone graft. Probably less important to them is what it allows us to do as far as orthodontics. It's just amazing technology. Kodak helped us stage an event where we had a Kodak representative come and talk to the dentists about 3D imaging and the benefits of that, and the response was universally just very positive. Very glad to be able to have that kind of technology, and in fact we have a number of dentists now who send their patients before they place implants to have a cone beam CT image taken. They take that CD back to the dentist so that he can look at it and determine whether or not there is room for them to place an implant. We had a patient whose upper first molars were erupting and dissolving part of the root of the baby tooth, which means that they're coming in too far forward, which means that there's crowding. And as we were able to show this image, which this is the first of these types of cases that I've been able to actually show the patient a 3D image of what's happening, it's just very compelling to see those teeth. We also can show soft tissue so that we can see how the soft tissue drapes over the facial skeleton and how the position of the teeth affects the soft tissue and the smile. Before, all we had was a panoramic survey x-ray that would show it, but you just don't get a sense of really what's happening or why it's important that we need to do something about this. The 3D, it just makes it very compelling. I have an endodontist friend who has a cone beam machine, and he said that he has told me that prior to cone beam, when he would do root canals, it's like if he were reaching around the trunk of a very large tree and trying to do a root canal blind. Now that somebody's removed the tree and suddenly he can see things that he just wasn't able to see. At some point, this is going to be standard of care. These will be in every office that practices dentistry of any kind. The study model issue has been a big issue. I mean, obviously practicing 31 years, you'd have rooms full of models, especially if you take study models, plaster study models before and after treatment. If we have a digital record of the way the teeth are, which is obviously a lot more accurate than an alginate impression and a study model, I mean, it really simplifies our ability to keep records and to be able to archive and retrieve them later on for whatever reason. I have friends and study club members, colleagues who have other machines, and I think the biggest thing that surprised me is the ease of use and the user-friendliness, I guess, of the software. It's really infinitely possible to manipulate images, and it's very easy for staff members to familiarize themselves with it. I mean, I just can't imagine practicing without having this additional information to be able to see 3 dimensions, to just be a better orthodontist, and that's what it's all about.